of you have been asking, what are the career opportunities in medical laboratory science? If you're a scientist or a medical laboratory technician, then stay right here. This video is for you. My name is Ndulaka Joy. I'm a medical laboratory scientist, and today I'm going to help you with career opportunities in medical laboratory science. So get your paper and pen or your notepad so that you can go with me. Alright, the first on the list is clinical laboratory, or what we call bench work. As you can see, I'm in the laboratory. Yes, so we have bench work. What this one does is that you work in a medical lab or in a clinical lab. There you collect samples from patients, run tests, give the result to doctors, they make their diagnosis, and that is it. Right, so working in clinical laboratory is that you can find jobs in teaching hospital lab, maybe private lab, university lab, federal medical centers, right? So where you get to interact with patients and then the doctors. Okay, so this is one career opportunity in medical laboratory science. Now the second one is academics. This one, you decide to be a lecturer or you teach any aspect of MLS. You can get jobs in the university, in College of Health and Technology, or even online through some portals where you can teach some of the courses that you learned in the field and you are being paid in dollars or even your country currency. The teaching sector is lucrative, highly lucrative. So don't see it as something that, is for maybe people who couldn't find job in the lab. No, it's lucrative. You can choose to write a textbook on any field of choice and you are being paid for it. Your students get to buy them and you earn more money. So this is actually one career opportunity in medical laboratory science. The other career opportunity in medical laboratory science is research. This one, I love it very well. I've worked as a research assistant to some lecturers and to some scientists in the profession, and honestly speaking, is amazing. What does research entails? First of all, research means that maybe you want to find out something. You see that the report on that particular thing is not sufficient enough, so you want to make your own findings. For example, you want to evaluate the liver enzymes in hypertensive patients on therapy, right? This kind of research, you want to find out, does the therapy affect their liver enzyme or not? So in research, you do some findings and you can propose your own theory, and once your theory is reproduced, you can get your Nobel Prize. And one beautiful thing about research is that you can even apply for grants and people get to fund your research as long as you are providing solution in the health sector. Alright, the next one is molecular diagnosis or molecular laboratory. This one is different from the clinical laboratory. Now, molecular laboratory has to do with DNA, PCR, where you just focus on molecular aspects of the field, that is MLS. Okay, so that is one. Another one is blood transfusion. People are making cool money. They call it blood money from blood transfusion, in the sense that, you get to get people who their blood is actually high, their PCV is high, and they can willingly donate blood, and you pay them maybe a little amount of money and then sell it at a higher range. Currently, we have people into this field and they are making cool cash. So you can choose to be a donor or you can choose to start a business. They call it blood business. It's not like the sacrificial blood business, but this time around is a medical blood business because you're actually saving lives. All right, and people can pay for value, any value that you offer. The next one that we are going to look into is the biotechnology. Another career path that you can follow is biotech. What does biotech do? As you can see over there, you can see that centrifuge. Yes, you can also see the spectrophotometer over there. Right, this is an aspect of MLS. You can call it bioinstrumentation or biotechnology. These people, they decide to work with most engineers so that they can fabricate machines that can solve problems in the laboratory. In the olden days, we usually use some method like Western method for ESR, and then PCV, you get to spin or leave it for hours. But this was decided, okay, we need to save time in the laboratory because many patients are coming in, and as they are coming in, you can't tell them to wait, whereas their result is actually urgent. Or sorry, they need their result urgently. At that moment, they now decided to use the principle of centrifuge to do what? Produce the centrifuge. Currently, we have auto analyzers. The machine does it for you and you get your results. So people who are in this sector are done, right? They get to meet startup laboratories, maybe teaching hospitals, they get contracts, and you are being paid. Once they fabricate machines for you, you pay them in millions of money. Okay, the next one, we talk about forensic. This part is actually crucial when you want to work with maybe force, like police force, navy, and all of that. This one helps in criminology. You get to know what actually killed this patient. It's actually in line with histopathology. Histopathology and forensic, they go hand in glove most times. The reason is that, histo can tell you what has happened in a dead body, right? So that's where forensic medical laboratory comes in. We run the test and discover that, what actually killed this person is poison, right? Instead of, the person drowned. Something like that. So you discover that forensic currently is done. If you get job, you can apply to any force in your country and they will pay you in dollars, right? This is one career opportunity in medical laboratory science. It's not crowded, all right? So this is one of it. Another one is pharmaceutical. This aspect is very nice, like super duper nice. For pharmaceutical niche, you get to work with pharmacies. You work in their lab, test drugs that are being produced, whether it's convenient or whether it meets the criteria for people to start taking that drug. All right, so if it doesn't meet, you say, nah, this drug can't go. But if it meets it, kudos, we can go ahead with the drug. Right, this part is actually lucrative because it's not many persons that specialize in pharmaceutical aspect of the lab. So if you decide to go in this one, you are being sought after, honestly. Another one we are going to talk about is health informatics. This niche has to do with giving information about health. You can see people who are bloggers, you can see people who write, and you can also see people who are into newscasting. But this time around, their niche is the medical field. Content creators can also come in this niche, just like as I'm giving you health information, I'm giving you career opportunities in MLS, so you can also categorize it as health informatics. The truth of the matter is that you can combine any of these career opportunities together and you are making your money, like your cool cash. Another aspect is entrepreneurship. Some people, they don't like bench work, so they decide to be selling equipment. Yes, so instead of them being in the lab working, they can decide, okay, I'm going to be selling some medical equipment. Another one is government agencies and international organizations, even non-governmental organizations, environmental and specialized field MLS people. So in this area, I'm going to combine them together. For government agencies, these are people that work with government, maybe Ministry of Health. They can decide to have some agencies like MLSCN, AMSIN, Association of Medical Laboratory Sciences of Nigeria. We have the WHO, World Health Organization. We also have Global Health Organization. All right, so these are organizations that you can work with and you are being paid without working on the bench. So these are career opportunities in MedLab, and you can even combine the two. All right, so for non-governmental organizations, these are people who want to do charity work. Maybe someone outside the country wants to be reaching out to communities. All right, so this set of people, they employ MLS personnel, doctors, nurses. They pay them on a monthly basis huge amounts of money. For me, one of the things I love is research. Like I said again, one of the niches I love very well is research. So for research, if you're interested in research, watch out for some of our subsequent videos. Not only research, because I'm going to walk you through all these niches in details. So watch out for our next video. Don't forget, my name is Joy Ndulaka. I'm a medical laboratory scientist. Yes, and I've been in the field for some years now, and I can guide you through some career path that you can walk through as a medical laboratory scientist. If you got value in this video, feel free to like, share, and subscribe. All right, this video is out there for you, and you can give it to someone who is currently going through the profession and doesn't know the career path to choose. In our next video, I'm going to walk you through the different specialties in medical laboratory science, just in case you are thinking, what specialty should I choose, or which specialty should I go into? All right, so I'm going to walk you through them. Give us a thumbs up and let's get it going. Thank you.